Welcome to the Pharmacy channel. I'm Dr. Hosam Khalaf, a certified clinical pharmacist. Today, we're tackling a crucial topic: antidepressants. We'll explore their onset of action, safe discontinuation, major side effects, effectiveness debates, and natural alternatives. Let's dive in with insights from the Lange textbook of pharmacology, Lippincott's illustrated reviews, and the American Psychiatric Association guidelines. Don't forget to hit the subscribe button to watch the next video. This video is for educational purposes only and does not replace personalized medical advice. Always consult your healthcare provider before starting, stopping, or changing any supplement regimen. Onset of action. You may be wondering why antidepressants take weeks to work. A common frustration with antidepressants is their delayed effect, typically 2 to 6 weeks for noticeable improvement. Why? SSRIs like fluoxetine initially block serotonin reuptake, but the therapeutic response depends on downstream neuroplasticity. Simply, over time, increased serotonin signaling upregulates brain-derived neurotrophic factor, promoting neuronal growth in the hippocampus, a key region for mood regulation. Interestingly, studies show that early symptom improvement, like better sleep within 1-2 weeks, predicts long-term response, while its absence suggests the drug may not work for that patient. Safe discontinuation. How to avoid the brain zaps. Stopping antidepressants abruptly can trigger withdrawal, often mislabeled as addict. Symptoms like dizziness, electric shocks, or brain zaps, and rebound depression occur due to sudden serotonin receptor changes. The American Psychiatric Association recommends tapering over weeks to months, depending on the drug's half-life. For example, paroxetine, short half-life, reduced by 10 milligrams every 4 weeks, while fluoxetine, long half-life, may not require tapering. Always consult your doctor. Some patients benefit from bridging with fluoxetine during discontinuation of other SSRIs. What about the major side effects and management strategies? While modern antidepressants like SSRIs are safer than older tricyclics, side effects still impact adherence. Here's how to manage them. Sexual dysfunction affects about 30 to 50% of users. If happened, you can switch to bupropion or add sildenafil, consulting your physician. Weight gain also is a common problem. Mirtazapine is notorious. In this case, consider SNRIs like duloxetine. Emotional blunting, dose reduction, or adjunct therapy may help. Serotonin syndrome, rare but deadly. Watch for agitation, fever, and tremors. Discontinue immediately and seek care. Fourth point is the dirty little secret, the effectiveness debate. Placebo versus drug. Meta-analysis reveal a controversial truth. 82% of antidepressant benefits mirror the placebo effect, with only an 18% added drug, often clinically insignificant. The Lange textbook notes this is especially true for mild to moderate depression. However, for severe cases, the difference widens. The dirty little secret? Pharmaceutical trials often bury negative data. For instance, 57% of unpublished FDA studies showed no drug benefit over placebo. What is the natural alternatives for antidepressants? Evidence-based options. For those hesitant about medications, research-backed alternatives include exercise. 30 minutes of aerobic activity 3 times a week boosts brain-derived neurotropic factor as effectively as SSRIs. Bright light therapy, effective for seasonal depression, mimics serotonin-enhancing effects. Omega-3s and Mediterranean diet, high EPA and DHA fatty acids intake, correlates with lower depression rates. Mindfulness and meditation rewires negative thought patterns, with relapse rates lower than drugs alone. Antidepressants are tools, not cures, whether you choose medication, therapy, or lifestyle changes. Remember, recovery is a journey. Always work with your healthcare team. For more expert insights, subscribe to the Pharmacy. Stay informed, stay empowered.